There are many respiratory disorders that require medicines to be given via a spacer. It is very important that the child uses the spacer effectively, otherwise they will not receive any benefit from these medicines. This video shows us how to set up the spacer and then to use the spacer very effectively so that maximum benefit can be given to the child.
Using a spacer is the best way for people with breathing problems to stay healthy. They are most commonly used when we treat illnesses like asthma. Spacers are very easy to use and they only take a few seconds to help the medicine go directly into the lungs, where they work best. As a healthcare worker, it's important that you tell families and children how to correctly use and maintain a spacer. There are mostly two types of spacer. One is large, 750 ml, the other is small, 250 ml, and each of these come in different shapes. Before the first time you use a spacer, it needs to be washed. This is very important. Warm soapy water is the best way to do this, and after you've washed the spacer, it's equally as important not to rinse the soap off. Just leave the spacer to stand and drip dry by itself. When the spacer is dry, you can then assemble it, ready to use. The spacer has two ends, one to breathe on and the other for the medicine. For children older than 2 years, spacers allow the breathing of the medicine into their airways more effectively. Breathing correctly allows the medicine to go into the airways. 5 deep breaths per puff, always keeping your mouth on the spacer, is the best way.
Good job.
After using the medicine with a spacer or a mask, it's important to brush your teeth. For children younger than 2 years, a mask is better than a spacer. The correct use of the spacer is essential for inhaled medication to be delivered effectively into our lungs, so we can stay healthy and breathe well.